Can you hear me okay? I have no idea what Father Tutriku said to you about me. It sounds like it was good. I hope I don't disappoint you, Father. I must say that we've been working together for 5 years now. As a deacon, I never dreamed I would have such a collegial relationship with a priest, a pastor, and I must say I love you dearly, Father Tutriku, and that you are a tremendous inspiration to me on a daily basis. So thank you so much for the privilege. We had a sad thing happen. My brother Deacon, we have 2 deacons in our parish, and we lost him 2 weeks ago, very suddenly, 59 years old. He was there with us celebrating on Sunday. On Monday morning at 2 a.m., he passed away. And we've been grieving that because we dearly beloved Deacon Danny, and we ask you to pray for the repose of his soul, although we feel quite certain that he's with the Lord. In terms of my background, I graduated from Dalhousie Law School in 1981. I did my articles in northern Manitoba, in the Paw, believe it or not. But soon after that, I became a Christian and a Catholic in law school. God can do anything. And did 12 years in the not-for-profit sector, working with various charities, housing for the homeless, second stage housing for people with psychiatric illness, a few other, working with people with disabilities. Then I went from there to the provincial government for 12 years, where I focused on respectful workplace, bullying, harassment, and racism. Not doing those things, but trying to prevent them. And then took this job with the Christian Medical and Dental Association as executive director in 2012. We're an association of 1,600 Christian doctors. It's a multi-denominational ecumenical organization. About 20% of our members are Catholic. And to give the evangelicals credit, they decided to hire a Catholic executive director because they wanted to have greater rapport and dialogue between the various Christian denominations, which has been very good. I was ordained to the diaconate in 2012 at the same time as I got this job. The two have been dovetailed almost perfectly because the deacon part of me gives me access to the bishops and to the Catholic hierarchy, and the lawyer part of me allows me to understand the legal issues around this. The pastoral part of me helps me understand the pastoral issues related to this in my diaconal training. Working with doctors is second nature because I'm married to a doctor and my son is a doctor. So that's all good. I hope you'll overlook the fact that I do have legal training. I'm really trying to quit. People bring it up all the time. Larry, you're a lawyer. And I say, well, yeah, but do we really have to bring up my sordid past? You know, are you merciful, or you want to keep bringing up my bad background? In terms of my calling to the diaconate, when I was in Manitoba, I felt like I was called to become an oblate priest in northern Manitoba. But that was soon after my conversion. And you know, it's really not good for people to pursue a vocation soon after their conversion, right? I got my wires crossed. But went off and did spiritual formation at a place called Madonna House in Combermere, Ontario. Some of you may have heard of it. And it was during that period that I recognized that I was not called to the priesthood, but really thought the diaconate would be a fantastic way to live out my life. When I met my wife, I had to put all that on hold because of her faith situation, but she knew that this was certainly in my heart. So it's something that's been with me probably for 40 years. And so once again, I never dreamed I'd be in a situation where I could live up my vocation and also do stuff like I'm doing. So it's a beautiful combination of, thank you, a beautiful combination of law, faith, vocation, and so I'm a happy deacon. So I just want to start by talking about what I'm hoping to do today. There are a total of 4 talks. I want to reassure you that as we go on, there'll be less and less of me talking and more of you guys having an opportunity to talk about pastoral situations and the application of some of this stuff. And if we can get the sound system set up, we're going to try to do a video at the end. So that will make it easier for you. The first session, I warn you, is more intellectual, more intense, okay? So this presentation is what's wrong with MAID. And in the next 30 minutes, I'm going to share with you, just to get us all up to speed, all at the same level, in terms of what's currently happening with MAID in Canada. So what is MAID? Well, MAID is medical assistance in dying. It consists of both assisted suicide, which is where the patient themselves must take the lethal medication, and also euthanasia, which is where a lethal injection kills the patient. The vast majority of cases in Canada are euthanasia. Only 1 or 2% are actually assisted suicide in Canada. So how did we get here? Well, it's a long and sordid tale. In 2012, there was a British Columbia Supreme Court decision by one judge. This judge overturned, using the arguments from the Charter of Rights and Freedoms, this judge overturned the sections of the Criminal Code that prohibited killing patients in situations where they had a grievous illness, disease, or disability. Now, the problem with this whole thing starts here, because the judge created the criteria. The judge created the criteria. Now, why is it a problem for a judge to create the criteria of who should get MAID? They're not elected representatives. They're not medical experts. They used terminology that was unknown to law and also to medicine. They used the term grievous and irremediable. Grievous and irremediable. No doctor, no lawyer knows what that means or where the line is drawn. So the problem with MAID started from the very first legal decision. Now, when it came time to go to the Parliament in 2016, the parliamentarians tried to narrow this broad definition. They said death must be reasonably foreseeable. But then that got challenged in Quebec. And once again, the legislation was opened up so that anyone with an illness, disease, or disability could be included. And these are the problematic words, disability, because it's not just a physical disability. At the same time, they also legalized MAID for mental health. So if someone, their only presenting problem is mental health related, that person will be able to qualify for MAID in 2027. Now, we had expected that they would add additional criteria for MAID for mental health. They have not. They have some suggestions that they've suggested to the physician. So the complete discretion about whether someone lives or dies will be in the opinion of the physician. And the suggestions are, well, maybe the person should have tried a treatment before you end their life. Okay? So this is extremely disturbing. This is already in place and will happen in 2027 unless Parliament changes it. In addition to that, they also added pre-qualifying. So you can pre-qualify in Canada now. So if you can get MAID today, you can set a date at some point in the future and have it done 2 years from now. That's also happening. And currently, euthanasia-assisted suicide up to 2023 have accounted for 60,000 deaths in Canada. So what's 60,000 deaths? Well, to give you an idea, it's roughly the population of Fredericton, New Brunswick. Or it's the number of people who went to Taylor Swift's concert in Vancouver. And the other thing you need to know is that the MAID providers themselves are, in terms of their practice, they are expanding the criteria themselves. So for instance, you may not realize it, but if you're on the autism spectrum, you currently qualify for MAID in Canada. If you are on the autism spectrum. If you are frail elderly, you can qualify for MAID. There were over 80 who were killed in 2023 in Canada. And we've even had a case where someone was deaf and qualify for MAID. Now, I'm going to say some things today that are going to really, you're going to go, really? Is that real, true, Deacon? Can we believe that? Well, the truth is that I've had this script reviewed by several experts in MAID, a lawyer, and my insurance provider. So what I'm about to say to you today is absolutely accurate. Now, where are we going with MAID? A parliamentary committee, a joint parliamentary committee, has recommended to government that mature minors be considered. What are mature minors? People under the age of 18. There is no lower age limit, and there is no set requirement that the parents give their consent. That's coming down the pipe. Advanced directives, Quebec has already approved advanced directives, and the federal government is, rather than challenge what Quebec is doing because it's unconstitutional, the federal government has decided to do a poll of other Canadians to see if advanced directives are also a good idea. And so this is rather pessimistic, but I think that we are headed towards death on demand, if we're not there now, but we're very close to that. I want to just talk about the rates of euthanasia in Canada. If you look at the chart there, you can see that the orange line is the Netherlands. They were the pioneers in this. They've had some form of euthanasia since 1980. And you can see that the axis on the left-hand side goes from 0 to 5. That's the percentage of all deaths in that country that are related to MAID. So the orange line is the Netherlands, starting in 2002. You can see they've risen to just above 5 deaths. 5% of all deaths in the Netherlands are due to euthanasia. And the yellow line is Belgium. You can see they've had a similar increase. Switzerland has been increasing at a lesser rate. The green line at the bottom is California. What you may not realize is that in those states where MAID has been legalized, it's only assisted suicide. So what we find is that there's far less uptake for assisted suicide than there is for euthanasia. And the reason for that is that people really still have a problem with suicide. So they don't want to actually bring about their own death, but they're okay with the doctor euthanizing them. So that's the difference between Canada and the United States. Now, but then you look at Canada, and you can see we've had a dramatic increase from 2016 to the present day. It's the red line. It's going sky high. Internationally, we're known as a bit of a mistake. Recently in the UK, when they've been talking about legalizing assisted suicide there, the people who were against it were constantly talking about the Canadian experience, saying you don't want to end up like Canada, because everyone around the world is concerned about this rapid increase. Now you may say, why is it going so fast? Why is such a rapid increase? Well, for one thing, we have the vaguest criteria in the world. Grievous or irremediable. Like I said, nobody knows what it means, and it's totally in the mind of, it's in the opinion of the doctor who does the assessment. The doctor who does the assessment, if they feel that the criteria are met, then that person can get MAID, and there's no way to challenge it. There's an obligation to advise. Almost everywhere across the country, the regulatory bodies are telling doctors that they must advise the patient if the patient might qualify. Well, the broader MAID gets, the more likely they are to qualify, and so the more patients you're going to have to advise about MAID, even if they don't ask you. In several jurisdictions now, facilities are required to provide MAID on the premises. And there's currently lawsuits. The Archbishop of Montreal, Archbishop Lépine, is challenging the law in Quebec because he has three facilities, hospice facilities, and the government is saying he must provide MAID on the premises. Same thing at St. Paul's Hospital in BC. Same thing going on there. People are allowed to doctor shop. So there was a lady who wanted MAID in Alberta. No doctor in Alberta would give her MAID. She went to Vancouver, where she found a doctor there who would qualify her for MAID. And there's the other thing is there's no obligation for the patient to try treatment. The disease must be irremediable according to the treatments that the patient themselves will accept. So if the patient doesn't want to accept, we had a case of a 27-year-old male who refused to accept treatment for his cancer. He didn't want to go through chemotherapy. Had a 65% chance of a full recovery. He declined the chemo and was euthanized. So these are, and the other thing now, there is no waiting period. So you can get a diagnosis in the morning, the MAID team comes to see you before lunch, and they set up your MAID for the next day. So people are not even getting an opportunity to sort through all of these problems. So what's wrong with MAID? Well, first of all, it endangers people who are experiencing vulnerability. The second thing is, if death is a therapeutic solution, what's the incentive to do anything else? And finally, we are not the authors of our own lives. First, it endangers people who are experiencing vulnerability. This is a quote from Dr. Madeline Lee. Dr. Lee is a MAID provider in Toronto. She's the one who set up the MAID process for the University Health Network. You can imagine that'd be a lot of people dying from MAID in that area. And she, 2 years ago, did an article for Maclean's, and this is a quote taken from that article. Canada's MAID laws are missing fundamental safeguards for vulnerable people. That needs to change. So that statement in itself from a MAID provider should give us all concern. This is what she said. The law does not require a clinician to sit with the patient and have a meaningful discussion about their desire for death and what social and societal factors might be playing a part. Rather than just checking boxes, we should have a meaningful conversation about the desire for death. She says, just because the patient qualifies under the criteria in the criminal code doesn't mean that you should actually kill the patient. She said those are two separate things. But what's been happening is the doctors are looking at it like it's a checklist. And there was one doctor quoted in a recent article in the New York Times magazine who provided MAID, and he said that the evaluation of patients sometimes takes him 15 minutes. He said if the patient, for instance, had pancreatic cancer, the evaluation would take 15 minutes. And he was quoted as saying, the janitor could do the assessment. No disrespect to janitors. Yeah. Dr. Lee says the current law has no place for clinical judgment and no stipulation for meaningful conversation. This is a problem that goes right back to that first judge's decision, because she said that in Canada, doctors would do everything they could to save the patient's life. But she was wrong. They are not doing everything they can to save the patient's life. As soon as the patient qualifies in their mind, they give them permission for MAID. There may not be any dialogue about the reasons the patient is choosing it. There are very disturbing cases about people being offered MAID. A woman from Nova Scotia, who I personally know, was asked 3 times if she wanted MAID in her interaction, during which she was getting a double mastectomy. She was asked once, standing in the hallway, or sitting in the hallway, nothing on but a Johnny shirt, waiting for the anesthesiologist to talk to her about MAID, about being anesthetized for the mastectomy. No husband, no nothing. We had a priest in Miramichi, New Brunswick, who was up on his roof doing some work. He's in his 80s. I told him, please, Father, stay off the roof. But he fell off and had a serious concussion. He woke up in the emergency room at the hospital. The first thing they wanted to do was sign some papers. He noticed that one of the papers said MAID on it. He said, I'm a Catholic priest. I can't sign a paper related to MAID. And the orderly who gave him the paper said, I'm sorry, Father, you have to sign. I have orders from on high. Meaning the administration was on the upper floor. And the priest said, oh, I'm sure that you didn't get those instructions from God, because God doesn't like MAID. So numerous examples. When people are asked, you can imagine what it does to their morale if they're asked if they thought about MAID. It's kind of an inherent, implicit assumption that they were a burden, and that their situation was so serious that dying is one of the possibilities. Sophia, another case of a lady who had environmental illness. She couldn't afford proper housing. She had sensitivities, chemical sensitivities. She went through COVID in total isolation for quite a long period, and finally decided that she was going to apply for MAID. But before she did, she explained in a video that she really didn't want to die, but she had no other option to be able to find the appropriate help. And so she was killed by MAID. But thanks be to God, her family got the videotape and took it to Avis Favreau, who's a CTV News health specialist, and that became public news. But this was a situation where she was given MAID because she qualified when there was a solution, which was simply to find her appropriate housing. Now, you may not realize this, but most of the people in your pews will think that people are choosing MAID because they're in total agony, which can't be treated by medical science, and we're just ending their lives because of it's more humane, like the way you would put down a dog. This is not true at all. This here talks about the reasons for MAID. Isolation or loneliness is 21%. Perceived burden on family, friends, or caregivers, 45%. Loss of dignity, 65%. Loss of ability to engage in meaningful activities, 95.5%. All of these that I've just mentioned can all be dealt with via counseling, but people are not getting the counseling. Now here's pain, inadequate pain control or fear of pain, 54%. But the interesting thing about this is it includes fear of pain. Lots of people will fear pain, and all you have to do is get a palliative care doctor to come in and talk to them and help them work through the actual process of their disease and how their pain will be dealt with. Palliative care providers tell us that all pain at end of life can be dealt with. So a lot of this is just fear of pain. And if they're not getting proper pain control, then that is an inadequacy in our healthcare system, which should be fixed before we start killing people because of what's going on. These sources of suffering here. I just wanted to show you this one stat here. This is just for the sake of completeness. I put the whole chart in. So we're going to send you all these slides so you have them. I just put this in so you'd have the whole complete chart. But look at this here, isolation or loneliness. I think it's 21%, and it goes up to 47% for people who are in track 2. These are people with disabilities who are not about to die. So this is a staggering statistic here. 47% of people who have chronic illness or disabilities, one of the reasons that they want MAID is because of loneliness and isolation. And this should make us think. The second point is, if death is a therapeutic solution, what is the incentive to do anything else? What you may not realize is that the legalization of MAID has completely changed medical ethics. It used to be that the driving force of medical ethics was to help people stay alive. Now, killing someone is a therapeutic solution. Now, you need to think about that because it totally changes the implications for any of your parishioners who are medical professionals. Because if any of your parishioners who are medical professionals don't want to be involved with MAID, and MAID is seen as a therapeutic solution, then that means in the minds of the public and in the minds of the pro-MAID folks, this means that your healthcare professionals are not caring for their patients. If a physician will not refer someone for euthanasia, then they are no longer properly caring for their patients. So care and death have become the same thing. Most of the people in the pews don't have any idea this is happening until they go to the hospital and a loved one ends up getting MAID or getting offered MAID, or they get offered MAID, and they go, this isn't what MAID's all about, and it's because they only understand what was the case in 2016. Our lay people are not, they have no idea about the things I'm telling you, and they have not kept up with how it has developed in the last 9 years. There's a problem with access to care. Disabilities, this is a direct quote from an article talking about people with disabilities during COVID. Many disabled people struggled to access healthcare services and felt they were invisible. As a result, individuals' mental health was negatively affected. And mental health in 2027, MAID for mental health will be legal. Well, it will be a 3-month waiting period to get MAID. In Canada, it takes an average of 6 months to see a psychiatrist. And public opinion in Canada is concerned about this. Look at this. 60% express concern that inadequate care may pressure vulnerable individuals to consider assisted suicide. So this is hope for us, because if we talk about this with our parishioners, this is a hook that we can use to get them interested in this issue. This is the most egregious case of this. Normand Meunier, who was a quadriplegic in Montreal, his wife took him to the emergency room because he had an infection, and they didn't have a room in the hospital for him to treat his infection, so he had to stay in the emergency room. In the emergency room, hospital policy did not allow them to bring a special mattress for a disabled person into the emergency room. They had hundreds of these mattresses in the hospital, but they weren't allowed to bring them into the emergency room because of lack of space. So Normand spent 95 hours in the emergency room being treated. During that time, he developed serious bed sores, and these bed sores became so large and so painful that Normand, after consulting with his doctor, decided to get MAID. So this is the most egregious case of where not providing services results in people getting killed. And there's been mounting criticism. This article here, Canada is Killing Itself, the author contacted me before she started writing the article, and I was able to steer her in the direction of some of these issues. This is the Atlantic magazine, which is not a right-wing magazine in the States. It's more center or left-wing. But they came to the conclusion that Canada is killing itself. 3 quotes. Carla Qualtrough, Minister of Disability Inclusion in the Liberal government, said it is easier in some parts of Canada to get MAID than it is to get a wheelchair. Carla Qualtrough. Krista Carr, CEO Inclusion Canada. I won't read her quote, but it's equally dramatic. Her and another disability group are challenging the legislation in court. And finally, the UN Committee on the Rights of Persons with Disabilities has said that Canada should repeal MAID for people with disabilities and chronic conditions. So it's not just in Canada, it's not just in the United States, but it's all over the world. We are known as pariahs for what we have done to disabled people. The Ontario Coroner's Report, one of the few provinces in Canada that has any kind of oversight. They have coroners look into these decisions. There were 428 cases of possible criminal violation in Ontario alone. In 2023, the Ontario Coroner's Office raised concern for a quarter of all euthanasia providers in Ontario. So in Ontario, one of the few places in Canada where there is some level of oversight, all these things have happened. But there has not been one case referred to the College of Physicians and Surgeons for a complaint. Why is that? Because MAID providers are saying that if we start raising complaints because of all these mistakes that are happening, fewer people will want to provide MAID, and then we won't have enough providers. Finally, the third reason is we are not the authors of our lives. It's very clear that the big guy, our boss, God, says, you shall not murder. And Jesus incorporates that in his dialogue with the rich young man. And then Jesus goes on to say, whatever you did for the least of these, you did it for me. So I, as a deacon, am sworn, committed to providing for the vulnerable. That's what I do. That's how my heart beats. That's where my passion is. And I do that because when I care for people, regardless whether they're homeless, whether they have disabilities, whether they have psychiatric illness, whether they're in a correctional facility, where they're alone and isolated, when I go to care for them, I'm caring for Christ. So the question I have is, the very people who are being attacked here are all people who Jesus says he identifies with. So what are we doing? And I always tell people, this comes directly from Christ. You know, this euthanasia thing, this anti-euthanasia thing is not something that our bishop dreamed up. It's not something the Pope dreamed up. It comes directly from the big boss. And Jesus says, if you love me, keep my commandments. That means don't go around killing people. The story of the Good Samaritan, you know, if anyone was a candidate for MAID, it would have been that poor person who was lying in the gutter. The Good Samaritan came along, the scripture says he was half dead. But Jesus doesn't say that the Samaritan reached down and gave him a lethal injection. He says, no, he took him and cared for him. And that's what we're called to do. So what's wrong with MAID? It endangers people who are experiencing vulnerability. If death is a therapeutic solution, what's the incentive to do anything else? And we are not the authors of our lives. Those are the key things wrong with MAID. I think I'm going to stop right there and start some discussions. I'm going to talk to you a bit later about the situation in Nova Scotia that Father and I are dealing with, where there is a crisis in conscience protection. But I think for now I'll just stop and we'll take questions and comments.